Diabetes is one of the top diseases in the Philippines. It is part of the top 10 leading causes of death globally. Marami nang namatay pero hindi pa tayo lubos ang bukas sa mga epekto dala ng karamdamang ito. Panahon na. Let's talk diabetes. Truth is, there is so much more to talk about diabetes. In order to achieve effective prevention and excellent care in the Philippines. Over 60 years of service. The prime mover for excellent diabetes care and prevention in the Philippines. With a vision for diabetes-free Philippines. Broadcasting from its home studio in Manila, with links to its 29 regional chapters all over the country. And now, reaching the global audience through this channel. Welcome to Let's Talk Diabetes, an online series brought to you by the Diabetes Philippines.
According to the 2019 data of the International Diabetes Federation, 1 in 11 adults globally have diabetes. 35% of adults with diabetes is in the Western Pacific region where Philippines is located. And the highest number of deaths of more than 1 million that occurred in this region is due to diabetes. Millions of people around the world suffer from this disease, but half are still unaware that they have diabetes.
In the Philippines, diabetes care in the country is disadvantaged and challenged with respect to resources, government support, and economics.
Here in Let's Talk Diabetes, our mission is to provide a better quality of life for Filipinos with diabetes through relevant and accessible content online.
You'll be seeing us in your mobile feeds along with your favorite YouTube artists. Kaya don't forget to like, comment, and subscribe. By the way, my name is Dr. Francis Pasaporte, your friendly diabetologist and the President of Diabetes Philippines.
Kumusta na kayo? I am Dr. Fatma Tew, your caring diabetologist and the Treasurer of Diabetes Philippines. We're very excited to launch this online series called Let's Talk Diabetes. In this series, we discuss how we can prevent diabetes through educational content for our patients and how we can provide excellent diabetes care through scientific discussions with our doctors, healthcare partners, and all stakeholders in diabetes care.
Lahat tayo ay bahagi ng misyon na mabigyan ng magandang buhay ang bawat Pilipino na may diabetes. Handa na ba kayo? Let's talk diabetes.
In pursuit of our noble mission, mapalad tayong kaakibat ang ating mga kaibigan na buong puso ang serbisyo para sa pasyenteng Pilipino. We have the officers and Board of Trustees of Diabetes Philippines, Dr. Francis Pasaporte, President, Dr. Marcia Tolentino, Vice President, Dr. Nines Bautista, Secretary, Dr. Fatma Tew, Treasurer, yours truly, Dr. Grace De Los Santos, Immediate President, and our reliable Board of Trustees.
Of course, we won't forget our frontline heroes who are vital in highlighting the importance of taking coordinated and concerted action. They are our beloved nurses and dietitians. Maraming salamat sa inyo dahil you ensure prompt treatment through early diagnosis. You provide patients with training in self-management. You provide psychological support and prevent life-threatening complications. Kaya naman hindi kami magsasawang magpasalamat. Saludo kami sa inyo.
As part of our goal to help the Philippines battle diabetes and its complications, we are fortunate to have 29 local chapters all over the archipelago. Each local chapter brings in unique observations and champions their own advocacies. This allows Diabetes Philippines to provide a diversified solutions with one common goal. Are you interested to learn more about their stories? Tara na, bisitahin natin sila.
Naku Fat, how I wish we could travel safely again. Sa ngayon, let's take a virtual tour of our local chapter in Batangas.
Hello, Dr. Eric Tenorio. Kumusta kayo dyan?
Magandang araw din po sa inyo, sa aming magandang host, Dr. Padma, at sa ating presidente, Dr. Pasaporte. Mula po sa mga taga Batangas, ay isang magandang araw po at sana po'y nandito po kayo tumihigop ng masarap na kapeng barako. Ako nga po pala si Dr. Basil Eric Tenorio, ang Pangulo ng Batangas Chapter ng Diabetes Philippines.
Doc, I am sure you have so much to share sa mga activities that you guys have done there in Batangas.
So, Dr. Francis, tama po kayo, sa amin po sa Batangas Chapter ay napakarami po namin activities, sapagkat ang aming pong samahan ay nag-umpisa nung nagkaroon ng Taal Volcano eruption. So dito po nag-umpisa ang aming activities na magkaroon po kami ng ginawang pagtulong sa mga taga-Taal na natabunan ng asphalt ang ating mga miyembro ng Diabetes Philippines National sa pamumuno ng ating dating presidente si Dr. si Dr. Francis Pasaporte, kasama po namin si Dr. Oliver Bautista at saka po yung mga kasamahan po namin sa ISDF. Doon po nabuo lahat ang mga tulong na napunta sa Taal sa tulong ng mga DP. At ang aming presidente po nung una ay tumulong po sa mga nakikita niyong mga nasalanta ng earthquake. At ito po ay tinawag naming Project M&M. M for medical and another M for materials. Nagpagawa po kami ng mga bahay, 25 bahay na nasira ng earthquake sa palibot po ng Taal Volcano. So yung mga nakita niyo pong mga bahay po kanina, yan po ay tinulungan namin, 25 bahay po. Sa aming po mga advokasya, meron po kaming 3 aktibidad na ginawa para po mabuhay o mag-improve ang mental health ng mga tao o mga pasyente, mga miyembro natin na nagkaroon ng COVID-19. At isa sa mga ito ay ang Bonsai Club. 3 po itong aming i-discuss na napaka-importante po naming adhikain. Una, ang Bonsai Club. Pangalawa po, yung aming aquascaping. At pangatlo po, yung aming Green Thumb, Project Green Thumb. Noong July, nag-umpisa po ang aming celebration ng 100 years of insulin. At dahil po sa assignment po namin kay President Francis, pinapili po kami ng 5 of our best speakers in Batangas. So, pinili na po namin yung aming 5 nagagandahang miyembro na magagaling pong mag-lecture. One is Dr. Caroline Montano, Dr. Florence Santos, and then we have Dr. Eden Karingal, and then we have Dr. Eden Karingal, and then we have Dr. Apolonia Villares, and lastly, our member, Dr. Jocelyn Muli Marcos. And then we have also our Diabetes Awareness Week. Nagkaroon po kami ng 2 lecture about protection of the kidneys, the complication of diabetes, neuropathies, and eye complications. Of course, ito po ang isang major achievement na nagawa po namin itong taong ito. 3 po ng ating mga doktor ay nakasali po sa the most top 10 eco-friendly clinics of the Philippine Medical Association. So ito po ang Healing Forest Clinic ni Dr. Oliver Bautista, the Karingal Medical Clinic of Dr. Ede, and my clinic, the Old Heritage Clinic, Clinica Tenorio. So sa awa po ng Diyos, nakapasa po kaming lahat at nanalo po kami 3 magagandang klinika sa buong Pilipinas. So yun po ang aming mga activities at thank you po Dr. Francis for inspiring us. Back to you, Padma and Dr. Francis.
Now let us visit the rice granary and the fruit basket of Southern Tagalog, the beautiful island of Oriental Mindoro. Hi, my very BFF, the gorgeous Dr. Jocelyn
Hi,
Marcos.
Doktora! Kamusta kayo dyan?
Hello, Fat, my BFF. Thank you for this opportunity and hello to the President of Diabetes Philippines, Dr. Francis. So I am actually very excited about this new platform, new medium that you are arranging to show to everybody what Diabetes Philippines has done in the different chapters, sharing what we have already done during this time of the pandemic.
Tama yan, Doc. And imagine, this time around, no matter how far apart we are, we get to share our best practices and our journey in this channel. Speaking of sharing our journey, why don't you take us through sa mga updates niyo dyan sa Oriental Mindoro?
So let me enumerate to you the projects that had been done by Diabetes Philippines Oriental Mindoro chapter. We contributed and participated in the various missions and donations by the Oriental Mindoro chapter. Aside from the missions and donations that we give out to our typhoon afflicted families, we also participated in the Kokomban project, and we termed it Kokomban project. It's providing A4 Kokomban to different public schools for the modules of these patients, of the not actually patients, but to the families of the students in the public schools. We do have also, since as I have said, it's a virtual, so we do have lay fora in our local radio station during the medicine week, and we're in one disease entity per day for the entire week was discussed. And for us, the Diabetes Philippines contribution was a discussion on diabetes Wednesday. And of course, we have several virtual scientific lectures. So all in all, the diabetes lectures or CME contributions numbered to around 30 lectures for from February up to the present. That is for this year. Other contributions, of course, being virtual, we participated in the Diabetes Philippines Insulin Lecture Series. So that's all of my humble contributions to Diabetes Philippines. And this is Dr. Joji Muli Marcos, President of Oriental Mindoro chapter. And I'm now turning back the microphone to my wonderful and very hardworking BFFs, Fat and Francis.
How inspiring it is to hear everyone in their efforts to continue this noble mission of taking care of our patients wherever we are. Ngayon naman, we have one last area to visit, and let us go down south to Mindanao. Kumusta tanan sa atong maigsuon dira, Dr. Grace?
Hello everyone! Hello and welcome to the home of Mount Apo, the highest peak in the Philippines, and the beautiful beaches of Southern Mindanao here in Davao City. I am Dr. Aquitania, President of the Diabetes Philippines Incorporated Davao Chapter. Here in Davao, we are all well, and COVID is hopefully leaving us soon, and we're praying for that. During the pandemic, it's really challenging to reach out to our diabetic patients. So since last year, we have been doing virtual activities. So we regularly, every year, annually, no, we celebrate the Diabetes Awareness Week every July. And we gathered patients pre-pandemic, but then because it's already pandemic time, so what we did this year was for the Diabetes Awareness Week is we created a virtual forum. We invited experts, infectious disease specialists, endocrinologists, and allergologists to talk about the COVID vaccine. And in that forum, we were able to reach out to more than 5,000 viewers. And we clarified, okay, the flow was really very impressive. And we have clarified a lot of misconceptions about the vaccination of COVID. So earlier this year, no, with our desire to be able to reach out to our patients, we have to educate the doctors because we cannot hold diabetes clinics. No, patients cannot go to the charity diabetes clinics here in our locality. So what the chapter did was we initiated continuing medical education to teach our fellow doctors how to manage patients with diabetes. So early this year, in the first trimester, we did a summit, SGLT2 summit, and we were able to reach out not only doctors from Mindanao, but we have invited doctors all over the Philippines, and a lot of them were able to attend that SGLT2 summit. I know it's really a success, a very successful activity, well attended, and our speakers most of them are our foreign speakers who were involved in the innovation of the drug of the SGLT2 inhibitors. Another activity we did for the doctors was in celebration for the centennial discovery, 100 years of discovery of insulin. So with the efforts of the Diabetes National, okay, we cooperated with them and cascaded 5 topics, interesting topics about insulin therapy. So we did it monthly, once a month for 5 months, and we just concluded it this October. And it was also well attended. And the doctors appreciated it very much because they learned a lot about insulin therapy. So in this way, more doctors will be knowledgeable and be more confident in managing patients with diabetes. So we did that effort of reaching out to these doctors. And we believe that if more doctors are encouraged to manage patients with diabetes, more patients will be reached out and more patients will have better control of their diabetes. All of these efforts cannot be materialized without the cooperation and the hard work of all the members of the chapter of the Diabetes Philippines. So, yun ang nagustuhan ko sa mga kasamahan ko. They work laboriously. Talagang we labor, to make every project a success. And we are doing it not for our own personal satisfaction, but we are all in one in what's that? Our mission is to really reach out to our patients and make them healthy diabetics. So, Fatma and Francis, thank you very much for this chance of sharing to you what Davao City Diabetes Philippines chapter is doing here. Thank Thank you very much.
In the latest DOST FNRI trend, in the prevalence of diabetes among adults 20 years and above, it has been shown that there is an increase in the prevalence of diabetes from 3.4% in 2003 to 8.2% in 2018 and is continuously rising year on year.
Pero hindi ito napipigilan ang pagtutulungan ng bawat isa upang unti-unting mabawasan at maiwasan ang diabetes sa ating bansa.
2 years into this pandemic, both our patients and doctors have experienced challenges in diagnosis and management of diabetes. We've lost several heroes to COVID, and mostly due to their comorbidities like diabetes. We honor and thank them for their services to our fellow countrymen. In the succeeding episodes of our online series, we will share with you the innovative first-hand experiences of our doctors in the country in treating diabetes during this pandemic.
Diabetes Philippines promises to be the prime mover for effective prevention and excellent diabetes care for Filipinos with diabetes. We will continue to seek ways of expanding our knowledge and strengthening our practice for our patients.
That is true, Dr. Franz. Our initiatives to support our vision and mission is slowly coming to fruition through our advocacy programs, education and research, partnership and membership, chapters capacity building, governance, monitoring and evaluation, together with our business development initiatives. Different projects under these initiatives are being governed, and you can see a few examples on the screen.
All these are also something to look forward to in the 38th Diabetes Philippines Annual Convention and Scientific Sessions on November 10 to 12, 2021. This is just the beginning for our online learning series, Let's Talk Diabetes. Kayo, what would you like to be discussed?
As your favorite YouTube artist would say, comment your suggestions down below.
Comment down below.
And always, don't forget to like, share, and subscribe.
It looks like you're getting the hang of it fast. We're looking forward to spending more episodes with all of you.
Share this content with your family, friends, relatives, colleagues, and use the hashtag #TaranaStopDiabetes. We're in this together. Till then, see you in the next episode of Let's Talk Diabetes.